Did you know that by the time you finish watching this video, nearly 20 seniors will be diagnosed with dementia? That's one every 66 seconds. But here's the part almost nobody talks about. What if the cause isn't aging, but your own medicine cabinet? For decades, you've been told these pills are safe, routine, absolutely necessary. But new research is sounding a terrifying warning. More than 99% of seniors have no idea that at least one common medication they're taking can shrink key memory centers in the brain by over 28% in less than a year. Let that sink in. And the pharmaceutical industry? They've known for years, yet they continue making billions while millions slowly slip into cognitive decline. Seniors, beware! 9 popular medications that trigger rapid dementia. A major 2023 study in neurology and aging research found that one single class of drugs increased dementia risk by 49% within just 2 years. Today, we're exposing the 9 most dangerous medications linked to rapid memory loss and dementia, ranked from commonly ignored to absolutely mind-destroying. And number 3, it's prescribed to millions for something harmless, yet it quietly shrinks the very parts of your brain responsible for memory and clarity. Before we begin, tell us in the comments, what medications do you take daily? Have you ever felt sudden brain fog, confusion, or forgetfulness? We read every comment. We reply with personalized insights. Don't stay silent. This information could save your mind. Now, let's begin with number 9. And don't be fooled by its position. This one is hiding in almost every senior's home. Diphenhydramine, Benadryl. Diphenhydramine, the pink pill millions trust for sleep and allergies, seems harmless. But inside your brain, it can disrupt the hippocampus, the center where new memories are formed. It belongs to a class of drugs called anticholinergics, which block acetylcholine, the neurotransmitter crucial for memory, alertness, and learning. As we age, the brain becomes more dependent on acetylcholine. When this drug interferes, the results can be devastating. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergic drugs regularly had a 54% higher risk of dementia. How to protect yourself. Avoid anything labeled PM, nighttime, or allergy relief, often hidden forms of Benadryl. Switch to safer options like loratadine, Claritin, which does not cross the blood-brain barrier. Never assume over-the-counter means safe. Medication number 8, proton pump inhibitors, PPIs. Millions take PPIs for heartburn and acid reflux, often for years. But long-term use can block your body from absorbing vitamin B12, magnesium, and calcium, nutrients vital for cognition, mood stability, and mental sharpness. A 2016 study in JAMA Neurology found that regular PPI users had a 44% increased risk of dementia. Even worse, PPIs have been linked to increased amyloid beta plaque, a toxic protein associated with Alzheimer's disease. Safer alternatives. Taper PPIs with your doctor's guidance. Consider H2 blockers like famotidine, Pepcid. Natural options like D-glycyrrhizinated licorice, DGL, can soothe the stomach safely. Medication number 7, bladder control drugs, oxybutynine/ditropan. Oxybutynine blocks the same acetylcholine pathways as Benadryl, but it crosses into the brain even more aggressively. A 2019 BMJ study found that seniors who took strong bladder medications for over a year had a 49% higher dementia risk. Many seniors notice sudden forgetfulness, confusion, trouble focusing, losing track of conversations. But doctors rarely warn them. Safer alternative, mirabegron, Myrbetriq. Effective without the cognitive damage. Medication number 6, statins, Zocor, Lipitor. Statins lower cholesterol. But your brain needs cholesterol to function. It helps build the myelin sheath, which allows signals to travel smoothly between brain cells. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 on long-term statins had a 26% higher risk of cognitive impairment. Some reported sudden memory lapses, forgetting names, routes, or recent conversations. But not all statins are equal. Pravastatin and rosuvastatin are safer because they don't cross the blood-brain barrier as easily. Medication number 5, benzodiazepines, Xanax, Ativan, Valium. These drugs calm anxiety and help with sleep, but they also slow down the brain's learning and memory systems. A 2022 BMJ study found that seniors using benzodiazepines for more than 3 months had a 51% higher risk of Alzheimer's. Long-acting versions, like Valium, are even worse. Withdrawal can be severe, so never stop abruptly. Safer alternatives, buspirone. Cognitive behavioral therapy for anxiety and insomnia. Medication number 4, amitriptyline, Elavil. This older antidepressant is prescribed for sleep pain and migraines, but it's one of the strongest anticholinergics still in use. A 2015 JAMA internal medicine study found a 54% increased dementia risk with long-term cumulative exposure. Even low nightly doses can erode memory over time, slowly, silently, invisibly. Safer alternatives, duloxetine or gabapentin for nerve pain, melatonin or low-dose doxepin for sleep, sertraline or escitalopram for depression. Medication number 3, paroxetine, Paxil. Unlike most SSRIs, paroxetine uniquely blocks acetylcholine, making it far more dangerous for seniors. A 2021 review in Frontiers in Psychiatry found that paroxetine users showed declines in short-term memory, trouble recalling words, reduced attention span within 12 months. Seniors on paroxetine were 30% more likely to show early cognitive decline. Avoid entirely in older adults. Switch to sertraline or escitalopram. Medication number 2, antipsychotics, Seroquel, Risperdal, Zyprexa. Originally for schizophrenia and bipolar disorder, these drugs are now used off-label for sleep or agitation in seniors. A 2022 study in Lancet Healthy Longevity found that seniors given antipsychotics had a 71% higher risk of cognitive decline in just 12 months. They suppress dopamine, leading to emotional flatness, zombie-like behavior, loss of personality, dangerous falls. For many seniors, the decline is blamed on aging, but the drug is the real cause. Medication number 1, anticholinergic polypharmacy. This is the silent brain destroyer nobody warns you about. It's not just one drug, it's the combination. A senior takes diphenhydramine for sleep, oxybutynin for bladder issues, amitriptyline for pain, individually mild, together, a neurochemical storm. A 2022 study in Age and Aging found seniors with the highest anticholinergic burden had a 120% higher dementia risk within 10 years. That's more than double. Most didn't even know they were taking anticholinergic drugs. The fix: request a full medication review. Identify anticholinergic load. Taper unsafe drugs. Replace them with safer options. And here's the most hopeful part. Drug-induced dementia is often reversible. When the burden is removed, many seniors regain clarity, focus, and memory within weeks. Tell us in the comments, are you taking any of these medications? Have you noticed brain fog, forgetfulness, or personality changes? Will you speak with your doctor about reviewing your medications? Your story might help someone else recognize the warning signs. Thank you for watching and stay informed. Your mind matters.